All right, guys, this is like take 5 because I just continue to get interrupted by people coming in, by messages, by the intercom system, which is now 2 to 3 times the level it was before I left. It is Tuesday, April 4th, 2023. Yes, I am still in the hospital. Yes, I did get some clarification of what is going on. Now, one thing I'd like to note is for those of us with connective tissue disorders or people who've had a lot of surgical intervention, our internal organs may not present the same as obviously someone who's never had a lot of work. Clearly, that's the case. Now, depending on who's reading the scan, there are different levels of urgency and alarm, just based on how I've seen different hospitals react, different surgeons, different doctors. This happened to me actually in 2011 and 12 when I first moved to Colorado. I met with a cardiologist and a cardiac surgeon then, and they were convinced that my heart valve was going bad then because there was like higher pressure. They ended up speaking with my cardiologist in New York. They're like, no, this is just how her anatomy is. Everything is fine. And again, the valve lasted from 2011 till 2022, even still. And those guys at that point really wanted to do it at that time. Good thing I did not, because obviously more surgical intervention before it is necessary is not good. So the surgeon came in today, and I asked him what the heck was going on with the people downstairs. Why was everyone apologizing to me, apologizing that they couldn't do anything? You know, they were trying to be comforting, and I did actually, yes, have a nurse that told me that I was probably going to die soon. Now, I do have everybody's names, just because I had much fewer nurses downstairs than I did have up here. I'm not interested in narking her out. I hope that she will learn that certain things probably don't need to be said. And I think that the surgeon actually was pretty alarmed once I told him what had happened and how everyone was greeting me with these like morose, we're so sorry, your chart says no more surgical intervention. I was like, are you sure it's just not for the weekend because Dr. Schultz needs to be involved? I don't know. So I did ask him, he's like, well, no, I never said that. He's like, honestly, if your tissue to the graft was the issue, then yes, there would be, or no, there may not be anything that I could do, but that's not what's going on right now. I'm just trying to, kind of starve your body with the Coumadin so it allows things to heal up. And I did explain what people were saying to me. He asked me who. I said, I don't have the names. I just hope that he gave a talk to everybody, because these people had told me that they were in consistent text contact with him. So I thought they were speaking from a level or a point of credibility. But they were reading the scans and looking at everything just like anybody else would who didn't know my internal anatomy. And this is something to keep in mind just for those of you who have connective tissue disorders. If you are going to a new hospital or what have you, and suddenly it looks like people are being overly alarmed by something that they should not be, please refer back to your surgeon. At this point, I got the patient representative involved. She said, I do not have to listen to anyone at all except for the surgeon and his nurse practitioners, which I obviously am going to follow to the T now, because who knows who's reading what they're gleaning from it, what their conclusions are that may not be, rooted in reality. When this man has been in my body, he has seen what is going on. Now, if my body does not stop bleeding, he said that he may need to do another surgery and involve some biotape, I think he said. Now, of course, I'm like, why didn't you just re-cement everything while you were in there? I don't know. Maybe they just didn't really think it was necessary. Maybe now it's looking like, hey, maybe a good idea. I really need all of your energy extended to get me the heck out of here and stop this thing from bleeding so that I can leave, because I was doing much better at home. I need to go home. And that's really like the energy I'd like to extend out there. Now, yes, I was traumatized. My poor husband was traumatized. Everything has been very, very, very difficult. And here we go with another announcement to ruin the end of my video, because I apparently just can't get more than 5 minutes of peace at a time. Woo! Anyway, I hope you're well. I still don't know how to edit because I just don't care right now. I'm just trying to survive. Thanks again.